Hi, I'm Dr. Greg Castello, board certified family practice, and today we're going to talk about sore throats. Sounds like a pretty straightforward topic, but there's some intricacy to it. So when we think about a sore throat, we have a differential diagnosis, and somebody comes in with a sore throat and they want to go on an antibiotic because they think they've got strep throat. Only about 10% of sore throats are actually strep throat. Most of them are viral. So when we see a sore throat, we usually will split it into viral causes and bacterial causes. And we want to remember that bacterial infections get better with antibiotics. Viruses don't get better with antibiotics. So we want to know if I got a bacteria, take an antibiotic. If we have a virus, don't take an antibiotic. The bacterial causes can be further split into strep throat and other. So we have strep throat, and strep throat, we have that rapid strep test. It's a more common cause of bacterial, not all sore throats, but bacterial sore throats. The reason why we have a rapid strep test is because untreated strep in about 1 in 20,000 people will cause rheumatic fever. So we developed a rapid strep test. We don't want to miss it if you have strep throat and go home without an antibiotic, although very unlikely you could get rheumatic fever, which is a lifelong heart condition. So if we think you got a bacterial throat infection, we can do a rapid strep or a throat culture and determine if you have strep and you go on antibiotic. It's the miracle cure. Now, there are other causes of bacterial infections that can cause throat infections that will not show up on a strep test, so sometimes we'll put you on an antibiotic even if your strep test is negative if we have a suspicion that you have a bacterial throat infection, but it doesn't show up on a strep test. Okay? So let's go to viral infections next, and the majority of sore throats are going to be virus related. So upper respiratory infection like a cold virus would be the most common cause of a sore throat, either from postnasal drip or just irritation from the virus in the back of the throat. We have what I call the mono-like infections. A mono is a virus infection. Epstein-Barr virus, mononucleosis, mono, all means the same thing. And that's a family of viruses that cause a more severe throat infection. You get pus on the tonsils. You're fairly sick with this. And this is generally what's considered a mono-like infection. And the reason why I call it mono-like is because there's other infections. CMV is another infection, cytomegalovirus, that is mono-like. One called toxoplasmosis. This is a infection you get from cat feces from litter boxes. That can mimic mono. That's actually treated with an antibiotic, but that gives you mono-like symptoms. So when I see someone that I think has mono, they typically have very swollen tonsils. They have a muffled voice, pus on the tonsils, golf ball sized lymph nodes, very big lymph nodes in the neck. Oftentimes you can see their lymph nodes when you have them look up. They oftentimes have lymph nodes in the back of the neck, which is classic for mono. You can get lymph nodes above the collarbones, lymph nodes in the armpits, lymph nodes in the groin, enlargement or irritation of your liver or your spleen. These all make me think of a mono infection. I have a rapid blood test I can do for mono. I have antibody blood tests I can do. So if my rapid blood test is negative, I send off antibody blood tests for mono, for cytomegalovirus, for toxoplasmosis. I look at liver function blood test. If your liver blood tests are abnormal, that's typical of a mono-like infection. We do a blood count. If the white blood count is elevated, that's more likely bacterial infections. And we go back to strep and strep's other bacterial cousins. If your white blood count is low, we typically think of mono or mono-like infections. If we have what's called neutrophils on the blood, then we think about a bacterial infection. If we have lymphocytes or atypical lymphocyte white blood cells, we think again about viral infection. I want to know if you have a bacterial infection because I'm going to put you on antibiotics for that. If you have a virus infection, there's no specific treatment for mono or any of mono's cousins, so I don't oftentimes do the blood test. The benefit of doing the blood test would be is if you don't get better after a few days, and I think, do I need to put you on antibiotics? Why aren't you getting better? I'll try and diagnose you with mono or a mono-like infection. I also want to know if you get sick and you're not getting better and days and weeks now go by, it's good to know if you have a mono infection or mono-like infection. If we play sports and we don't want to have contact sports because you can get rupture of the spleen, if I diagnose you with mono, I may give you 6 weeks off of sports. So lots of different infections. The majority of them are viruses. Of the viruses, we've got just regular cold viruses. We've got mono, which is a specific virus. We've got cytomegalovirus, toxoplasmosis, which are other mono-like infections. We have other infections that don't have a name, don't have a blood test, but they give us liver abnormalities and white count is low and atypical lymphocytes, and then we'll call it a mono-like infection. No specific treatment for that. We've got strep, which we always want to treat because of that low risk of rheumatic fever. I've got a rapid strep test, can send off a formal throat culture, and I've got other bacteria which will show up on a throat culture but not a strep culture. So if we're going to send off a bacterial, we want to make sure we do a bacterial culture, which will tell me other bacteria. If I send off a strep culture, the lab will just tell me yes or no for strep. Don't expect to get antibiotics necessarily when you go to the doctor's office, especially if you have cold symptoms like cough or congestion or stuffy nose. Those are more typically upper respiratory or viral infections. Don't ask for an antibiotic. Interestingly, if we have mono and I give you amoxicillin or a couple other amoxicillin-like drugs, you'll actually develop a rash. Can be fairly severe rash, and we also could maybe confuse that for an allergy. Now for the rest of your life, you tell the doctor you're allergic to amoxicillin because when you had a throat infection, you took it and you got a rash when that actually may have been mono. Dr. Castello, thanks.